Hello, my name is Rosan Meyer. I'm a paediatric dietitian, and I'm doing this recording to provide you with very practical guidelines on how to practice remotely during the COVID crisis. I will be referring during this recording also to the wonderful document that has been produced by the British Dietetic Association Paediatric Group, and that has been authored by Dr. Louise Marino and myself, has been reviewed also by Julie Lanigan, and is out for all of the pediatric dietitians practicing from home. For the last 5 years, I have offered already consultations from home, either phone or video consultations. I've used a variety of different platforms and wanted to share some practical experience. By no means is this recording a complete guide, but please use the document which I will show you on the screen now that is freely available to dietitians. This document really will help you to look at what you need prior to the consultation, during the consultation, and how to also keep track of your documentation. So, before you actually start with your consultations from home, it's first of all making sure that you're practicing according to GDPR and what your trust also allows. So your trust will tell you which type of software you can use and what is GDPR compatible. Some of the trusts don't allow for video consultations, and it might just be phone consultations. For all of the dietitians that are doing a private work, and for the first time now starting with remote consultations, please note that the vast majority of the free video consultation services are not GDPR compatible. So normally you have to pay actually for additional protection. I certainly do that, and I also have an encryption service, not only for emails, but also encryption service for saving files. The next aspect is to assess what information do you have available prior to your consultation. That depends on your trust. Some of you will have remote access, but it could be that some of you actually have nothing outside of a patient and maybe a baseline diagnosis. Here it's important to do a little bit of preparation work, and that is one difference where I found face-to-face consultation and video or phone consultation differ. You do need to do a little bit more in terms of preparation and also preparing the parents. The preparation in terms of the parents is first of all to manage their expectations. I have a document that I set up beforehand, and it could be that you as your dietetic department can set up a document to say, what are you expecting? How long is the consultation? And that's really, really important, because often those last 2-3 minutes of a consultation is when they really come with all of your questions. So I do normally start with the consultation is saying, what are you expecting from me? What would you like to achieve? And what can I actually deliver? Secondly, in that document prior to your consultation, you want also the parents to send as much information to you in a secure way. So you need to use a secure email as possible. That may include photos of their growth charts. So a lot of them, I find that their red books, they have maybe the raw weights, but they have not been plotted, which allows you then at home to plot it for the parent. I also find it very, very useful to have a food diary. I do maximum 3 days of food diary that they send beforehand. And in particular for complex children, if you really don't know and have not got the records, whatever the parents have at home, they might have some blood results at home, they might have some letters at home, and also in their own words, the medical history. I know that can be quite laborious because you do get quite a lot of notes through, but I find that very useful. And finally, a lot of parents, especially the gastro ones, have got stool pictures. That is very useful, but remember they cannot share any pictures of a child with their face. In eczema, for example, they can show you a picture of the eczema of the trunk, but any pictures of the genitalia and that area, you should tell them quite clearly that they should not be sending any of those pictures. So once you're ready now for your consultation, This is where the documentation and the document from the BDA pediatric group becomes really, really useful. So I'm going to share my screen with you to show you how it goes through these different steps. It's absolutely possible to go through an ABCD, so anthropometrics, biochemistry, clinical assessment, and dietary assessment within a consultation. And that is exactly what we're trying to do with this document. And I'm now scrolling down through the topics that I've already covered with you. So you will see we are starting off with anthropometrics. And with anthropometrics, ideally you've had some kind of weight sent by the parents beforehand. We also provide within this document, and that you can share with the parents beforehand, ideally, how to do measurements at home. Of course, this is not a replacement of any measurement that you'd want to be having by a health clinic or within a hospital. But these are proxy markers with equipment that the parents have at home. So we've got guidelines for just a normal standing digital scale, how to do a weight there. If a parent is as lucky as to have baby scales, how to do that. And if nothing is available, because if nothing is available, you might just have past weights, past length measurements, and you have to ask whether the parents are feeling that the child is growing, whether they're changing clothes, how are they looking clinically in terms of subcutaneous fat, what is the general complexion, and then form your little puzzle, put it together with your other markers. You might have no bloods, but you have a good indication in terms of clinical assessment. If you are lucky to have a video consultation, I do request the child to be around. Be careful when you ask the child to be around. I normally ask them either at the beginning or at the end of the consultation, and that can be assessed with the parents during your consultation time. If you don't have a video, you need to ask targeted questions. How is the skin looking? How is the baby pale? What about the nails? All of those questions, and also stool frequency, consistency. You just need to be a bit more detailed than what you do normally with a face-to-face consultation. With a dietary review, this is where it becomes really useful having something beforehand, where you can actually just go through detail. And then, of course, at the end, you provide them with a plan. Again, I want to just reassure you, this document has everything that I've said and much more detail than what you would normally do. And we even have guidelines on the mid-upper arm circumference. We also provide you at the end of the document some guidance on documentation. Please follow your trust guidelines in regards to how you can document. Whether that is just on paper or whether it is electronic, whether you have access to your trust and you can direct documentation. But make sure whatever you do, number one, your documentation is GDPR compatible. If you are going to store it on a computer, that's your home computer, I would strongly recommend that you're looking at an encryption of the file. If you need to do it by hand, think already about how this is going to be transferred for your hospital notes and whether that is compatible at all. And finally, we have here also some guidance on color coding, whether you're worried about growth, whether you're not worried about the growth. And those children that you're worried about, you'd want to have a phone or a video consultation on a more frequent basis. I am going to end up this recording by saying that video consultations or phone consultations are not easy. But if you work together with parents, and in particular, manage their expectations and put them also at ease, and that's so important during this very heightened time of anxiety, because the parents will have often multiple children at home, dad is at home, and you might hear lots of background noise. So it's really important to try to keep the consultation very calm, use all of your verbal and listening skills. And I do believe if you do all of that, you can still provide a very safe service for your patients until the service for dietetics has been normalized. I hope this is useful, and as I said before, please access the BDA Pediatric Group document, as I think that's a really, really useful document for all of the dietitians practicing at home.